Welcome everyone to Let's Talk. I'm your host, Ingrid Lockley. Our special guest today is Britt Coward. She is with the Full Circle Grief Center located in Richmond, Virginia. And Britt is here to talk about the grief process and what is grief all about. Welcome, Britt. How are you?
Thank you. I'm happy to be here. Thanks for having me on.
Oh,
Doing
thank you.
well.
Thanks for joining us. We do appreciate that. But we upon all the holidays coming up, and this is a tough time for a lot of people. They're grieving for many reasons. I want you to kind of share with the viewers what exactly is grief.
Yeah. So grief really is any reaction, normal, natural reactions to the death of a loved one or any type of loss. So it can encompass a lot of symptoms and look different on each person. But simply put, it is the normal, natural response and reaction to either the death of a loved one um, or anticipating a loss, because we have grief over anticipation of a loss, or a non-death related loss as well. Certainly, we grieve those types of losses.
Yeah, I want to ask you a question. And a lot of people, when they think about grief, they think about loss of a loved one. But can they
Mhm.
grieve about other things such as loss of job? What are some of the things they can grieve upon?
Absolutely. Yes. Divorce, right? Any family dynamic changes
Mhm.
certainly can bring up feelings of grief and loss, loss of a job, loss of abilities, right? Maybe you have, an illness or have been diagnosed with something. Certainly there's going to be grief and loss there. Empty nesters, I mean, that's a real kind of normal developmental stage that family units, couples go through,
Mhm.
parents go through when their kids leave the nest, so to speak. So loss just encompasses everything. Estranged relationships. Um, it, I mean, the list can go on and on.
Yeah, that's
So
interesting. Yeah,
yeah,
the strange relationship. That's a new one for me, and probably for a lot of
yeah.
folks who are viewing.
Yeah,
Strange relationship.
absolutely.
Very
Sure.
interesting.
There's family members or even friends, right? That something happens that drives a wedge between the relationship and maybe really changes the dynamic.
Mhm.
And maybe you lose contact altogether, or maybe it just changes the quality or the depth of the relationship. And there's loss in that.
How interesting. I want to ask you a question, Britt. What are the signs of someone who might be grieving?
Yeah. So we think of grief in terms of symptoms or signs. I like to think of symptoms, but grief affects us comprehensively.
Yes.
So impacts all parts of ourself. So can impact us intellectually, emotionally, physically, spiritually. Um, I'll start with emotional kind of symptoms, and again, grief looks different on everyone.
Yeah.
And so some folks may experience these symptoms while others may not. Or maybe you experience symptoms in the acute stage of grief and loss, but then those dissipate and other symptoms show up later on. So it really just depends for each person. It's very individual. Um, but generally speaking, some emotional symptoms would be shock, numbness, disbelief, extreme sadness,
Mm.
anxiety, depressive symptoms, um, despair, guilt, anger, sometimes relief. So any and all of those can show up after a loss. And oftentimes you're experiencing many symptoms at once. And
Wow, that's interesting. I was going to say you a lot of time when folks lose their loved ones, um, it tends to be a harder struggle for them because at first you get the phone calls, you get the texts and the visits, and all of a sudden kind of slows down a little bit. Do you find that the
absolutely.
clients deal with the kind of a feel of being not necessarily neglect, but like, where's the folks that were there when I first lost my loved one?
Yes. Yeah, I mean, absolutely. There are people that show up right after a loss, and that's extremely helpful, uh, often to have those supports around you. Um, as time goes on after a loss, sometimes those folks fall away,
Yeah,
and sometimes they don't, right? And then there's other people that show up at different times during that grief journey. And so I think, that is certainly telling to the grievers. And sometimes it's just figuring out who's able to be there for what. There are some friends and family and supports along the way that are able to show up in some ways and not show up in others. Um, and so, it's and the grievers needs change, right? What needs to be done, or the support that's needed right after the loss of a loved one is different than 6 months later, 12 months later, 3 years later.
yeah,
And so there are those people, those angels, right, that just are there for whatever you need. And those those folks are really priceless in this process. um yeah.
I wanted to ask you, you mentioned guilt.
Yeah.
Um, when you say guilt, are you referring to maybe someone to maybe mend or patch up something that they always want to do or didn't resolve with their loved one, or
Yeah.
the employer, or
Yeah.
is that what you mean when you say
Yeah, I
guilt?
think guilt is, it can have a connotation and to it that maybe is not so positive. But what I would like to say is that guilt can be a really normal process of grief.
Okay.
Sometimes it's a protector for us. It's the guilt can come with the what ifs, right? What if I had done this? Maybe this wouldn't have happened. Or if only I would have said this or shared this, I would feel better right now. Or, whatever it is. There's a lot of ways to layer on the guilt. And sometimes we just need the space and the forum to to be able to say out loud the guilt that we're feeling. Sometimes it's rational, a lot of times it's not, but it just needs to be identified, processed through. Because if we stay in this place of guilt, and then there can be a bigger piece of shame that sometimes is attached. And we don't work through that, or find ways to kind of reconcile those feelings or let some things go, then it can kind of keep us stuck in our grief.
Yeah. Yeah.
And so it's a really normal, natural component to grief, but it is important to unravel that a little bit and be able to
Okay.
process all the feelings through, but certainly the
Mhm.
guilt, so that we can learn how to move forward.
Yeah.
Um, yeah,
Yeah.
there's a lot of other things that come up in terms of symptoms of grief. And cognitively, intellectually, someone uh, may realize that they're just feeling disorganized.
Mm.
Super common after a significant loss. We call it grief brain, where your memory feels impaired, your concentration is off, you're not able to focus. That's really common. It can be very unsettling, but super
Mhm.
common. Lack of motivation, fear, worry. So those can also be really normal.
Okay. And you said it's
Uh,
called grief brain. Is that what the
Grief
word?
brain.
Grief brain. Okay.
That's
That's
kind of our
interesting.
slang term for just that normal fogginess
Mm-hmm. Yeah.
after a loss. And sometimes that can ebb and flow, but last for quite a long time, where it's just,
Mm-hmm.
people maybe who are used to multitasking,
Mm-hmm.
And after a significant loss, they can barely focus on one thing to completion. So it impacts us cognitively,
Mm-hmm.
kind of can rewire our brain for a bit after a significant loss. And so our memory, concentration, focus is taxed in a different way when we have a significant loss or experience trauma. Um, a lot of that will return to
Okay.
kind of
Okay.
before loss functioning, but it is important just to know that that can be normal.
Now, when you say a lot of it will return, is there a time limit or a space that allows that, or is it based on every individual?
Yeah, I think it's based on individual. I think maybe we're going to talk about coping in a minute, but certainly
Yes, we
being
are.
able
Hmm.
to, allow yourself space to
Okay.
really
Okay.
find ways to cope healthily.
Okay. I want you to hold that thought. Sometimes I'm
Yeah,
gonna ask you, when it comes to children grieving,
yeah,
talk a little bit about that when it comes to our children.
yeah, absolutely. Um, so yeah, so kids are wonderful,
They are.
wonderful little beings.
Hmm.
Um, when children grieve and experience a loss, it's different than adult grief. Um, their attention spans are shorter, just developmentally so. So children will tend to grieve in spurts. And it's kind of the best way to describe it, where they'll kind of grieve intensely and
Hmm.
then kind of, you know, be their normal little 5-year-old self or however
Hmm.
old. So they shift more quickly between emotional states and behavioral states.
Okay. Okay.
So as adults, it's just kind of meeting them where they are and knowing that they could be crying 1 minute and then playing with their game or their dolls or their friend another minute, and seem perfectly fine. Um, so it can take children longer to feel the impact of a loss. As adults, oftentimes we're just bombarded by a loss and begin to feel, not always, oftentimes we can certainly feel that numbness, but the
Hmm.
reality of the loss on some levels typically hits us right away. Where with children it can take a little bit longer. Um, it's important for their environment to feel safe and stable so that they can express themselves.
Okay.
Just really important. They need outlets to, for their energy, for their oftentimes, um, with children who are grieving, their emotions and feelings will come out in their behaviors. So being able to have safe, supportive outlets for them to release, but
Hmm.
also helping them to understand on their level what happened,
Yeah.
and to identify some of these complicated, maybe confusing um, feelings that maybe they're not used to feeling,
Right.
and giving, kind of labeling those for them. Also, understanding that developmentally, when a loss occurs, that is really different for children. So children under 6, 5, 4, it varies
Hmm.
with each child, but they may not understand the finality of death. They may think it's reversible. Typically kids that are 6 and up, 6 and 7, understand that, you know, that it's not reversible, but sometimes there can still be that magical thinking, right?
Yeah.
Something they did or didn't do, caused it, or something you know maybe they will do could hopefully bring them back, or
Right. Yeah.
um so it's just important to find, supportive ways to allow them to express their feelings.
Yeah.
Routines are really important. Kind of, you know, having them have have some continued structure, can be kind of stabilizing and safe for
Hmm.
children who've had a significant loss. Obviously,
And what would that
being
look like, Britt, when you say
yeah,
stabilization? What does that look like for a child of that age group that you mentioned?
yeah, I think sometimes keeping, even just daily living routines, right? Meal times and bath times and bedtimes and
Hmm.
school routines. I mean, certainly things get shaken up when tragedies happen or when losses occur. Absolutely. But as much for children as we can try to have those parameters around those routines that feel safe to kids.
Yeah,
We
absolutely.
kids need those, children need those guardrails
Yeah.
to kind of know what to expect.
Hmm. Hmm.
Um, so yeah, and being direct and honest, certainly tapping into support, professional support if you need help to be able to take care of yourself, tend to your grief so you can
Yeah.
best support your children who are grieving, but also sometimes just to get, some helpful language around how do I share with my child what happened
Yeah.
in an age appropriate developmental way.
I want to ask you, Britt, too, with the adults who are grieving, you mentioned about a little bit more, meet them where they at. Is it because they're dealing with a lot of the adult things as far as maybe taking on the mortgage, even trying to figure out
Mhm.
how to pay for if they lost a loved one, funeral costs? Is
Oh,
really more the big
absolutely.
responsibility
Yes.
coming in?
Yeah, there can, those tasks, true tasks after a loss, can be so taxing and demanding. Some people do really well in
Yeah.
that mode because it's something to focus on. And sometimes when we're in, believe it or not, when we have some of that numb disbelief, that's a protectant for us to kind of be able to take care of some of those tasks that need to be
Hmm.
taken care of after a loss.
Yeah.
So for some people, they're able to kind of pour their energy and focus into that, and it can be helpful. For others, it is extremely taxing and overwhelming, creates a
Yeah.
lot of anxiety. And that may be something where a support person could step in and help with some of those steps or
Yeah.
tasks.
Mhm.
And it goes back to kind of those roles sometimes, right? When there's a loss in a family, that now all of a sudden we're expected to assume that role. Well, may have no experience or idea on how to do it or what to do it. Or what
Yeah.
to do. But the physically too, for children, for adults, grief is really impactful. It's exhausting. It's an exhausting process. So I think realizing that just you know the toll that it can take physically on
Yeah.
somebody. And so there can be sleep disturbances and appetite disturbances, headaches, stomach aches. Grief can manifest in ways that show up physically.
Hmm.
So body aches, outbursts, crying episodes. So, all of that again can be really normal, natural
Hmm.
responses and reactions to grief. But it can feel very unsettling,
Yeah.
kind of out of body experiences almost for someone that hasn't been through it.
Yeah, and I would imagine so. Even with the adolescents, sometimes they may even act out in school.
Mhm.
Or maybe show some different
Absolutely.
behaviors. Either a norm because of loss of a loved one, or a loss of maybe even a girlfriend or boyfriend at that age group, adolescent wise in high school. I
Yes.
would think that will change some maybe academic wise. It can change the behavior.
Absolutely. I think I had said that with children and teens alike, oftentimes their emotions will come out in their behaviors, right?
Hmm.
So you know, it's not uncommon for grades to drop. Maybe they're sleeping more, they're missing, absenteeism, late to school, relationships,
Yeah.
peer relationships changing.
Yeah.
Maybe they're leaning more into those as an escape a bit or a coping.
Hmm.
Maybe they're withdrawing. Yeah. So really observing that, if you're the parent of a teen or adolescent who is grieving, really being able to observe kind of how they are in their different environments.
Yeah. Kind of monitor that
Yeah,
as they move forward.
exactly.
Yeah.
Right.
I want to ask you about the duration process of grieving. Let's talk about that a little
Mhm.
bit.
Yeah. So the grief is not something, we talked about it being a normal, natural reaction to a life event, right? We would love to think that as humans, we, don't go through the heartbreak of having loss,
Yeah.
and experiencing the heartbreak of grief, but we do often if we live long enough.
Yeah.
Um, and it's a natural, normal occurrence. So it's not something to be fixed. There's nothing to do to fix grief, so to speak. Um, Certainly, there are ways to support it, to help it feel easier to carry at times.
Hmm. Yeah.
Um, so it's ongoing. It will evolve, it will change, but it is an ongoing process, right? If you ask anybody who's had a significant loss, maybe, they had that in their 20s and you're talking to them when they're in their 70s, and it's still a loss.
Yeah.
It still
Yeah.
hurts.
Yeah.
Um, they they may be able to carry it in a way that it doesn't it's not impacting them on a daily basis, but it's always with them. We're forever changed. And so
Hmm.
the goal really, Ingrid, is to figure out how do we move forward in life and integrate that loss.
Hmm. Yeah.
How do we carry that person with us throughout our life in a way that feels meaningful, um, where we can remember them.
Yeah. Yeah.
Um, yeah, a long time ago, it used to, it was kind of like you just cut it off, right?
Right. Yeah.
Um, or you pack it up and put it over here, and you don't
Mhm.
you don't pull that out.
Right. Yeah.
But we know that grief and loss and those folks in our life that are so meaningful to us, that when we lose them, that will always have an impact. So
Absolutely.
it's life changing.
Yeah. Britt, I'm glad you said that because for some, they might have lost a loved one that they did not have a close relationship with. And so they
Mhm.
know this person who lost someone and they talk about them every day. There's not a time to go by. However, the other person may feel, hey, it's been 5 years now. It's
Yeah,
been 10 years now. It's time to
yeah,
move forward. So I'm
right.
glad you brought that up. That is really no time for that. You got to
That's right.
always kind of, if it helps you to talk about them, share stories about them.
Mhm.
So yeah, yeah,
Absolutely. And I think that's why for grievers too, it's finding, for some folks, it's really helpful to find that community where, and maybe it is some of your closest friends or other family members.
hmm,
Um, but maybe, it's finding community in people that you didn't know before who have
yeah,
had a similar loss or have a shared grief experience
hmm,
where you feel safe and comfortable, even
yeah,
if it's been 5 years or 10 years, talking about your loved one or talking about the pain that
yeah,
you still
yeah,
feel.
yeah,
Yeah.
yeah. I was going to say, especially for those, anyone, period. But when you've been married for so many years,
Mhm.
and you lose your significant other, and it's like for a lot of people, it's like, how do I carry on, how do I move forward, that
Yeah,
person with me for 40 years, 50 years, and sometimes in some cases longer than that is, and it's a struggle for them. um,
absolutely.
yeah,
Yeah, it's what is your identity now, right? When
yeah,
you've been partnered with a person, you know, for the majority of your life in a lot of
yeah,
instances.
yeah, yeah,
Um,
Yeah. I want to talk about some coping skills. What are some of the
Yeah.
coping skills that, that can kind of help someone along this journey of grieving?
Yeah, absolutely. Um, we've talked about how everybody's different,
Yes.
and may need different things at different times along their grief journey. We have there's kind of a spectrum, but there's a really good visual that talks about intuitive grievers and instrumental grievers, and then there's you know, a whole lot of space in between for blended grievers. And
Mm,
oftentimes we're a combination. But the intuitive griever is someone who really needs to talk, who really needs to process their feelings and their grief emotions, tell their story of loss, talk about their person, talk about, you know, in some cases, the trauma that occurred. Um, and instrumental grievers are those that need to do, right? So maybe they're outside working in their garden, or they're building something,
hmm.
or they're, exercising,
Yeah.
right? It's oftentimes and it may be action or meaning making that's connected, to their person or to the loss, or not. But they just need to move. And oftentimes, we do a little of everything,
Yeah.
especially across like our whole journey of grief. But so it's finding, what it is, and ways, environments that you can express your feelings in a healthy way. Um, so finding community, certainly finding folks that understand. So
Hmm.
people may do that through groups, through other friends or family members that they know have had loss experiences, that they may be able to connect or relate to. Community can be small or it can be large, right?
Yeah.
Sometimes even showing up for a breast cancer survivor walk, right?
Yeah.
That's community, and could be very large. So it can be, a whole scale. Doesn't have to be huge. It may be very small. Um, Finding those healthy comfort activities. What are those that help you to feel grounded and less anxious and
Hmm.
calmer in your grief? For some people, it's being at home and cooking, or taking a bath, or reading, or watching a show. For other people, it's going out and doing something, right? Being part of something, or being just outside.
Yeah.
I mean, there's a whole host of things, that can provide folks comfort. Self-care is really important, and by that I don't mean going to get a pedicure. I mean, what does sleep hygiene look like? What are you having sleep disturbances? How are you helping to support your sleep? Because that's critically important. Your nutrition and
Hmm.
eating habits, because those can certainly be disrupted.
Yeah. Could decline. That's true.
That's right. And that can have an impact on our functioning. So looking at those. And then restorative movement, right?
Mm,
What are we doing to that feels good to our bodies, that doesn't feel taxing?
hmm.
And so for some people, that's walking. For some people, maybe that's spinning on a bike.
Yeah.
For some people, maybe that's yoga, meditation. What
Hmm.
are those restorative activities that, that can kind of fill you up or
Hmm.
bring you some calm? Um,
I
and
want to
then,
ask you. I want to ask you a question, Britt. Let's take a step back when you say about the pedicure. Now, someone might say,
yes,
because someone might say, you know what? Now why does she say that? That makes me really feel good and kind of
yeah,
um, occupy my mind. But I'm feeling uh, that's something I want to do to get maybe not forget about the person, but kind of for that moment, kind of do something that's kind of distracting, so I won't boggle down my brain thinking about the person or the loss of the
absolutely.
job. So,
Yeah. And I would put that in the comfort activity,
okay.
kind of category, right? So finding those comfort activities, and that certainly, getting a pedicure or getting a massage
Okay. Okay.
or, curling up and watching a good movie by yourself or with a friend or with your spouse, right? Like
Yeah.
those are comfort activities.
Okay.
But
Okay.
self-care, sometimes I think, this kind of buzz of self-care can be kind of, you know, be a big catch-all. And
Yes.
when we say self-care from in my line of work, we really are talking about sleep,
Mhm.
nutrition, and restorative movement.
Right.
So absolutely get your pedicure. I think that can
Right.
be a wonderful
Right.
relaxation is
Yeah.
important, but just different
Yeah. Yeah.
than
Yeah.
self-care.
Yeah.
And some people want professional support, counseling, a therapeutic group. Um, Others may not,
Yeah.
may find that they don't need that. They have enough support through family members or friends. Or, I mean, the nice thing is, there's no time limit on that, right? It
Hmm.
could be that seek counseling right away. It could be that you don't and you may not want it or need it or feel like it's necessary initially. And then something else happens in your life and it brings up your grief bucket of stuff.
Right.
And that could be 10 years later. And you think, maybe it would be helpful to seek some therapeutic support or professional support.
Yeah. Yeah. Now let's talk about the support groups. I'm glad you mentioned that.
Yeah.
So, what are some of the ways that people can get the support that they need?
Yeah.
Help them along this journey of grieving.
Right.
Mhm.
Yeah, I think the biggest thing is just getting informed, right? So, if you are somebody that is wanting, needing um therapeutic support for your grief, you know, Googling, talking to people, calling us. I mean, in our area specifically, we are a comprehensive grief center. So we do groups, we do individual counseling. Um, when we have the capacity and bandwidth, we do community outreach and response. Um, so all of our groups here at Full Circle are no cost, um, which is wonderful. We have some very specific loss groups for adults, like suicide loss group. We
Yeah.
have a substance use overdose related loss group. We have a pregnancy infant loss group. We have a family unit uh, grief group for family, parents and guardians who have children between the ages of 3 and 17 who are grieving. Um, and then we have some more general grief groups. Like we've got an online group that we're going to be starting that's for any type of loss
Oh,
that will meet monthly or twice a month. We've got some partnership groups. We have a homicide support group that meets weekly over Zoom. Um, we have a child loss group that meets in person once a month. So we've done some partner loss, widower support groups
I think that's
um,
great. Yeah.
before. Yeah, so it's very varied. They're all listed on our website, but they are no cost. Registrations required. Individual grief counseling, we take some insurances
Mhm.
for. We also have a self-pay rate. And then there's other groups in the area, which is
Mhm.
wonderful. There's some hospices that do bereavement outreach and some individual or grief work after a loss. There's a program called Grief Share, which is a national program. They run grief groups out of local churches. It's a peer-led group. Um, and there's other groups that kind of pop up
Yeah.
that have different grief spins. There's some other widower support uh, groups in the area as well.
Okay. I
um,
want to ask you, Britt, what are some of the specialists that can also address grief?
yeah, specialists like
Yes.
professionals.
Psychiatrists. Yes. Uh-huh. Yeah. From
Yeah,
that level.
yeah,
What are some of the specialists?
great
Yeah.
question, because sometimes that can be a little confusing for
Yes.
people.
Can be. Yeah.
So I will tell you, I'm a licensed clinical social worker. LCSW, so you will see those initials.
Mm-hmm.
So I can do clinical work, and I specialize in grief, obviously. There are licensed professional counselors, so LPCs. They can also do clinical counseling therapy work.
Okay.
We have some LPCs here at Full Circle Grief Center. There are PhDs that, doctorates of clinical psychology that we can all do kind of, we have some different, maybe spins or the training and education path is a little bit different,
Right.
but we can all do clinical counseling work.
Okay.
Um, and then there are master's level folks that certainly can do counseling as well. We have some of those here at our center
Okay.
that don't have their clinical license, but they have their master's and have experience,
Mm.
in different areas, and they're able to see clients. Um, Psychiatrists, we refer to those folks. There's doctors of psychiatry. There are also psychiatric nurse practitioners. So these are folks that specialize in the medication
Mm-hmm.
management and do evaluations to see if maybe medication is a piece to the puzzle, for some folks who are, having anxiety or
Yeah.
depressive symptoms.
Mm-hmm.
So in our case, associated with grief,
Yeah.
or maybe had a pre-existing condition,
Mm-hmm.
diagnosis, mental health issue, then had a loss, right? And so sometimes, those what supports and interventions those folks need can change along the way. Um,
Absolutely.
yeah,
Absolutely.
so we don't have any psychiatrists that work here at Full Circle,
Mm-hmm.
but certainly that is a component, for some of our clients. Absolutely.
Yeah. Yeah.
There's all different pieces to the puzzle, right?
Yeah. Yes, it is.
Friends,
Absolutely.
family, supports,
Yeah.
groups, counselors, therapists, psychiatrists,
Yeah. Yeah.
other doctors sometimes.
Question for you, Britt. So those who are not in the state of Virginia, is there just a generalized website they can go to find maybe a LCSW in their area, or is there
Yeah,
a general number they can kind of contact and say, hey, I live in this state here. I'm looking for, someone could help me with
right.
events. Is there a local number
Yes,
for
you're
that?
you're asking such great questions, and that does bring up for us here at Full Circle, we can just see folks in Virginia.
Mm-hmm.
For our individual counseling practice, we see folks in person as well as via telehealth. So we
Mm-hmm.
do have some folks that may live in Northern Virginia or Charlottesville or, Southern Virginia. Um, but yes, for folks that may be seeing this, and be thinking, wow, I want to know counselors or therapist professionals in my
Yeah.
area. There is a platform called psychologytoday.com where you
Okay.
can put in your locality, put in your city and state, and then it allows you to do a filtered search. For you can search for therapists, support groups, and psychiatrists, and based on your needs, whatever issues that may be presenting,
Yeah.
you can select those. You can also, there's a space on there to select insurance or self-pay
Yeah.
or sliding scale. So you select these items, that are appropriate for you, and then you hit the search button, and it'll auto populate with professionals, agencies that meet that criteria. And it's nice because it'll give you a bio, a blip,
Yeah.
about that professional, their contact information, so you can get in touch with them to see if perhaps it would be a good fit. It'll often tell you if they're accepting new clients or if they're on a waiting list or if they're telehealth only or also in person.
Yeah, very valuable information for our viewers. And just in case they, like I
Yeah,
said, in a different whole state other than Virginia,
absolutely.
they have an outlet, say, hey, this is some great information. I need help.
Yes,
That's great information.
absolutely.
Yeah,
And
absolutely.
we, Ingrid, feel free to share our website.
Hmm.
We do we've got some blogs and what we call conversations about grief, which are video clips on there. We have a whole host of resources listed on our website. We put out this, it's called our bereavement resource manual. And we do have some hard copies, but it's online.
Okay.
And so a lot of the psychoeducation that we touched on grief, it's a lot, that's all in here, way more in depth. And then there's also a section for local resources. And then there's a section for different types of losses and different types of grief, for websites that could be helpful, books that could be helpful, podcasts that could be helpful. So it's just a nice resource, honestly, for anybody to have.
That is awesome, Britt.
Yeah.
Now, Britt, how can, if someone wants to get in contact with Full Circle, what's the information they can get in contact with you?
Yeah, if they go to our website, if they're interested in individual counseling, they certainly could, and they live in the state of Virginia, they certainly could contact me directly, via telephone call or email. We also, through our website, have kind of a general individual counseling email that folks can email through. And then for our groups, if you select the support group tab and you go to that page, there will be a contact person listed for each group that we do. Okay. And that's who you would contact to get registered or to ask questions, learn more about the group and what's involved.
Okay. Now, what's the website, Britt, they can have?
Yes. You could either Google Full Circle Grief Center and we would likely come up, or go to Full Circle GC as in Grief Center.org. So fullcirclegc.org. Our number is 804-912-2947. That's our general number, and then it has a whole host of extensions you can choose from. If you don't choose an extension, it will come to me. So we will certainly call you back.
Wow. Britt, this is awesome. I mean, I couldn't think of a perfect time to talk about this. As I said, the holidays are coming up. And just in general, this is very resourceful information for the viewers. Again, you guys, you heard Britt Howard. I highly suggest you guys reach out to Britt and utilize information she has provided. And Britt, I want you to come back in the future to kind of talk more about grief, if you can do that at some point in time.
Absolutely. Yes. Thank you so much, Ingrid.
You're most welcome. Absolutely. And guys, if you have to reach Let's Talk, you can also send us an email at ingridlockley, at letztalk.org. That's ingridlockley at letztalk.org. Send us an email if you have any resourceful information for the community. We'd love to share that with them. And again, we appreciate you guys viewing. And again, thanks again, Britt, for joining us today.